Welcome to my YouTube channel, Alfred Atanda, MD,
where we discuss hot topics in orthopedic surgery, sports medicine, telemedicine, and other digital health innovations,
and vlog about day-to-day life as a physician. Please enjoy the next video, and don't forget to like, comment, and subscribe to my channel.
And today, what I wanted to talk to you all about is a hot topic in the pre-med, post-bac world of what do you do to shadow a doctor, or how do you shadow a doctor? When I was coming up, I went through 4 years of college, 4 years of med school, and I had never shadowed any physician, ever. I didn't have any family friends that were physicians. I didn't really know anybody personally that was a physician other than my own doctor, and I never shadowed them. But now that I look back, I think it's incredibly valuable to shadow physicians. You got to see what you're getting into. You got to see what they do on a day-to-day basis. You got to see whether or not you like it, whether you think you can handle it. The first thing, first and foremost, is you want to think about what to wear. Whether you're a guy, whether you're a girl, your first impression is going to be based on the way you look. And depending on your shadowing setup or situation, sometimes like in our department, we have a coordinator who handles all the students and all the shadowers and gets their paperwork together. So they're a great source to just ask, like, hey, what do I wear when I show up? And they're usually a good judge of the doctors you're going to be working with and can give you some advice. Also, if you're not going through like a coordinator and you're just chatting with a doctor that you know or a family friend, just ask them. Say, hey, listen, thanks for letting me shadow. I really appreciate it. I'm going to be coming next week. What do you think I should wear? Depending on the weather, depending on the environment, they'll be able to give you some tips. But just in case you can't chat with them, you can hit Google and take a look. Well, let's start by looking for business casual women. And if you go to images, you can see what pops up. You can see lots of different things here for business casual. These sorts of things look reasonable. I would say probably what this woman is wearing. Don't necessarily need high heels, but dress pants, a blouse. Let's see, I think this is reasonable. Nice top with pants, dress shoes. She looks like she's doing something professional, potentially could be shadowing a physician. Let's see, where did that go? So a nice shirt, sweater top, it's probably reasonable. Let's go back to the search. This is a probably nice schematic. Business casual attire, dress slacks, skirt, nice blouse as well. And for the guys, is also a nice look. You don't necessarily need a tie per se, but dark socks, dress shoes, khakis, some sort of sweater or shirt is good too. So now if we go to business casual men, I think for a young male student, you don't necessarily need a tie or a blazer. I think a nice collared shirt, dress pants, dress shoes, what this guy has on is totally reasonable. Depending on the weather, a nice sweater. Again, you don't necessarily need a tie. I don't think it can hurt. This gentleman looks quite appropriate for shadowing, kind of like what this schematic shows, something kind of nondescript. Nothing with a lot of logos and letters, but just using common sense, you probably can't go wrong. So now that you've gotten in the door and you've been seen and you've presented yourself with your attire, next thing is, well, what do you say when you get there, right? You're going to be around a doctor, maybe they're a nurse practitioner, maybe they're a physician assistant, a resident, a fellow, an athletic trainer, as we have in our sports medicine department. There's a lot of people there, and you have to know how to interact with them. Some of them are going to be very friendly and very open and be engaging and bringing you into the conversation. And some of them are just going to be doing their jobs, and they're just trying to get through the day and go home and do whatever it is they need to do. So don't take anything personally. Remember, you're just an added addition to the clinic day or to the OR day. Nothing revolves around you. So if people aren't talking to you, don't feel bad. But you have to think about what you were going to say. And most of the time for students, you're better off being seen and not heard, specifically in surgery. I know that seems kind of callous to say, but you can't go wrong if you tend to be quiet. Now, you don't want to be like a fly on the wall and completely ignore everybody when they talk to you. You want to be a normal human being and just interact with people. But you don't want to go into too much detail about yourself and who you are and where you're from, unless obviously they're probing you and they're asking you these things. But talking about your significant other, talking about your pet, talking about going to the bar the night before isn't probably the best conversation pieces. Talking about kind of where you're from, why you want to be a doctor or why you want to go into medicine, any experiences you've had as a patient is all very good, discussion points. But again, you don't want to be too forthright with this information. You just want to kind of be there, let the doctors and the team do their job. And if they engage you in conversation, obviously respond and be polite and be cordial. The next order of business as well, what do you say when you're in the patient's room? Because that can be very, very anxiety provoking. You're in a room with a patient and a family. It may be a serious topic like something like cancer or some terminal illness or a bad disease. It could be something very simple like what we see in our office, whether it be an ankle injury or a knee injury. But either way, it's a tough time for the family and the patient. The doctor and the team are just trying to get through the day, and then you're there. So what I recommend is, again, just kind of hanging out in the back or in the corner, smile at the patient, act like you're interested in the conversation that's going on. You nod your head back and forth. You smile when appropriate. If somebody says something funny and everybody laughs, maybe you can, chuckle a little bit. But obviously, it has to be very appropriate. You technically don't want to be remembered in the patient's visit. You want them to kind of know that you're there, but you don't want to really make your mark. That's not the place to do that, because invariably it's not something that is going to be, you're not going to be remembered in a good way. But just be pleasant. If it allows, you can shake hands with the patient. But most of the time, what I want my students to do is come in, just smile, just say, hello, I'm such and such. And then you stand there and you act like an interested member and just engaged and just kind of paying attention to what's going on. You wave and you say thank you when it's time to leave. Just to recap, make sure that you look presentable, you're dressing tasteful, use your common sense with whatever it is that you decide to wear. If you're not sure, ask. Definitely be pleasant and polite to the team members. Don't say too much. Just respond to what people ask of you and just be a normal person. Be engaged when you're in the room with the patient. Act like you're interested. Definitely don't fall asleep or anything crazy like that. And lastly, just have a good time and good luck.